Hello and welcome to this edition of Recitals. This will be for the month of May and we are going to discuss social issues. Today we'll be covering a few themes. We'll be covering smart cities, we'll be covering the pharma sector, we'll be covering spice exports from India, and we'll be covering cancer coverage under Ayushman Bharat. More or less what we are doing is we are going to add on to the information that we have covered over a period of time. Smart issues, smart cities, for instance, we have covered over a period of time. We'll be both revising the topic, revisiting some of the ideas, and we'll be adding on to information. Let's start off with an overview of smart cities. Now, the Smart Cities Mission is a centrally sponsored scheme under the Ministry of Housing and Urban Affairs, and it was started in June 2015. Why do we need smart cities? Now, it's a well-known fact that the urban population of India is growing and we are going to become a highly urbanized country in the decades to come. And along with that, there is another important factor. Climate change is going to eat away a lot of our cities, especially the coastline is going to be damaged very severely by the rising sea levels. Now, what this essentially means is that we have cities that are growing within the country besides the 4 major metros, and it's necessary that we invest in these cities and make them future ready. So smart cities very nicely fits into that idea of an inevitable change that's happening and also the growth that's happening. Now, what are the objectives of the smart cities? It's to ensure a decent quality of life to the citizens through the application of smart solutions. Now, it's also to drive economic growth through comprehensive work on the social, economic, physical and institutional pillars of the city, and to drive sustainable and inclusive development. Now, basically a smart city is a city that's livable, sustainable and has a thriving economy and offers multiple opportunities to the people who are living in its confines. Now, initially 100 cities were chosen for a smart cities program, and this was supposed to be for a period of 5 years. But we did not really clearly define what a smart city was. The idea of a smart city evolved over a period of time, which is actually a very smart way of going about it. Instead of confining ourselves to a certain set of patterns, we evolved over a period of time. Now, the central government initially allotted 48,000 crores to the smart city program. This was to be used over a period of 5 years, and that essentially works out to roughly about 100 crores per city per year. And an equal amount of money was to be provided by the state or urban local body. Now, the mission was originally to be completed in June 2020, but has been extended till June 2024. What are the main components of the smart city program? The smart city mission has 2 main aspects. It has 3 main components: redevelopment, that is city renewal; it has retrofitting, which is city improvement; and greenfield projects, which are like fresh projects. That is basically an extension of the city. And they were also supposed to have pan-city solutions based on ICT. These would further compromise, or rather these would be categorized into 6 categories, would include e-governance, waste management, water management, energy management, urban mobility and skill development. Now, when we talk of urban area-based development, this is another major component of the smart city movement. It had basically 3 components to it. One, redevelopment. When we talk of redevelopment, it would be where the area is only about 50 acres. Then we'd say it's a redevelopment of the city. Retrofitting would be over an area of 500 acres in the city. And greenfield, which is fresh developments, would be in an area of 250 acres. Now, what are the main ideas of smart city movement? It basically places the community at the core. And it's also sustainable, so we have to create more from less. And it's cooperative and competitive federalism. We have discussed many times how smart cities are ranked, smart cities are continuously given out awards. So basically everybody learns from everybody, still competes. So it's basically competitive federalism, cooperative and competitive federalism. Then integration, innovation, sustainability. Now, this is another important idea that has been re-emphasized over and over, to reduce waste and to reuse things. So that is another important aspect of it. Then technology as a means and not a goal. That is another major component. And convergence, sectoral and financial convergence, to ensure that the cities actually become smart cities. Now, what are the features of comprehensive development in smart cities? We wanted to promote mixed land usage in the city for unplanned areas, and containing a range of compatible activities, so that the cities would be future proofed. Now, the housing would be developed, would be inclusive for everybody. Urban housing is a massive problem. We have discussed this idea in one of the previous lectures. Please do visit it. And one of the ideas was to create walkable localities, reduce congestion and air pollution, resource depletion. Now, what happens in the cities today is that we all travel great distances. The future cities that we are trying to develop, the smart cities, would have everything in walking distance. So basically, we put less pressure on the environment as such because of our traveling. And also it leads to a less stressful life. Now, another major component, or rather major feature of the smart city, was to preserve and develop open spaces. We'd have parks, playgrounds, and recreational spaces. Now, all these things are actually being destroyed in the cities around the world. So the smart cities that we are planning would actually include all of this. Now, it's also, one of the other features was to have a variety of transport options. Right now, urban mobility is an issue. So this was again included in it. Now, the other thing was to give the cities an identity based on their main economic activity, such as local cuisine, could be health, education, art, crafts, culture. So every city over a period of time would have a very clear identity of its own. This is not really an unusual or unheard of idea. Many cities across the country, when we refer to them, we say, oh, they're known for their brass work, oh, they're known for their pottery, oh, they're known for their dances and music. So this now would become an idea that would probably be accepted at a global level, wherein a city in India would be known across the world for what it actually specializes in. Now, the other main feature was to make governance citizen-friendly and cost-effective by increasingly using online services to bring about the city together, to create greater accountability, greater transparency, and also reduce costs. And the last important feature of a smart city was to apply smart solutions to infrastructure and services in area-based development. Now, when we talk of a smart city, these are the main ideas. You have a society, you have creativity, training and inclusion, you have quality of life. That was supposed to be a major aspect of smart cities. Instead of people just existing, we now start to imagine a future where the quality of life that people have actually has an important role. Quality of life would be culture and well-being, would be health, safety. Now, the government is actually paying a lot of attention to these aspects. As we will discuss in the topics today, for example, healthcare has become an important aspect of our daily conversations. We'll discuss that when we talk of Ayushman Bharat. The environment, sustainable buildings. Right now, when we construct in cities, cities really create a lot of destruction. So the future we'd have smart cities would be rather focusing on environmentally sustainable activities, resource management, and sustainable urbanism. Urbanism has always seen itself as being at loggerheads with nature. This is an old nature versus old debate of how man conquers nature, an idea that has been completely discredited. Now we are talking about living in consonance with nature. So sustainable development, that would be an important aspect of smart cities. Government, where the whole thing would be online, everything is open, everything is accountable. Economy, like I said, a city must have an economic activity. We should provide a means of livelihood to the people living there. But there should be productivity and there should be local and global connections to the economic activity happening. Then what we spoke of earlier, mobility. where we talk of infrastructure and technology, efficient transport, and multimodal mobility or multimodal transport options. So this is what a smart city is going to be or was aimed at. Now, what are the achievements of the smart city mission? Around 2 lakh crores was kept aside for public-private partnerships, and the important driver of the same, about 5% of the funds came through the public-private partnership. In order to make the mission a business model of governance, mission more effective, a business model of governance was adopted, and it bypassed the existing models of city governance in the country. And a special purpose vehicle led by a bureaucrat or a representative of the MNC and other major stakeholders was created and registered under the Companies Act. The Smart City mission, with an allocation of about 86,850 crores over 8 years, has achieved an impressive completion rate of 83%, which is quite staggering considering the way things drag on in our country and never get completed. Participating cities have utilized 72,571 crores, focusing on 21 sectors, including education, health, housing, water supply, solid waste management, and public transport. And the most common feature across all cities was integrated command and control centers, enabling monitoring of various urban functions so that everything could be coordinated better. And they have been instrumental, these urban integrated command and control centers have been instrumental in disaster response, flood monitoring, and on a daily basis traffic management. Now, what are the further achievements? As you can see, there were 100, this is as of 18th June 2024. This is data according to the government. 100 cities were chosen as we have described. There are about 7,152 projects, 89% of which have been completed. That is about 1,43,601 crores has been granted and given to the people. Now there are other projects worth about 8,010 projects have been approved, and they are worth about 1,64,063 crores. And the ongoing projects, these are the projects that are completed. Ongoing projects right now, there are 858 projects. That's a mere 11% of the total envisaged. And they are worth about 20,462 crores, so which is quite impressive actually. Now, what are the criticisms of the Smart Cities mission? The selection of the 100 cities was on a competitive basis, and implementation of the Smart Cities movement mission was flawed, as urbanization in India is quite dynamic and not static as in the West, because we are a very rapidly developing country. So some of the things that were envisaged did not really foresee a lot of things. Now, the Smart Cities mission became an exclusionary scheme wherein not more than 1% of the geographical area of the city was covered. This was a major drawback. The projects sanctioned under the scheme have seen a fall in the total outlay from the expected 2 lakh crores to about 1,62,000 odd crores. This is less than 16% projected capital flow in the 100 cities. Now, the SPV model designed for smart cities was not aligned with the 74th Constitutional Amendment, resulting in a top-to-bottom governance structure. This is actually a very serious criticism. In the name of executing smart city projects, there was a lot of displacement of people living in poorer localities. For example, street vendors have been shifted out. This is another one. Another major consequence has been enhanced flooding, enhanced urban flooding, because infrastructure projects dismantled water channels in some of the towns. Now, it's not all gloom and doom. Leading economies around the world have actually shown a lot of interest in the Smart Cities mission, and they're looking forward to coordinating with the cities in the country. some of the major countries like Spain, United States, Germany, France, Singapore and Sweden have actually already tied up with a lot of states and have become a part of the smart cities mission. For example, Spain wanted to cooperate to develop Delhi into smart cities, and the Barcelona Regional Agency of Spain had shown an interest in exchanging technology with India. United States Trade and Development Authority wanted to develop Visakhapatnam in Andhra Pradesh, Allahabad, right now it's called Prayagraj, and Ajmer as smart cities. Germany inked a deal with India to develop Bhubaneswar in Odisha, Cochin, Kerala and Coimbatore in Tamil Nadu as smart cities. Japan wanted to assist India in developing Chennai, Ahmedabad and Varanasi as smart cities. France decided to support 3 cities in India, Chandigarh, Lucknow and Pondicherry, which is also called Puducherry, and they wanted to spend about 1.3 billion euros. So this is more or less an overview of smart cities, and we have discussed this idea several times in the past, so please do visit those older lectures. We have added on to the information some of them. We've also revisited some of the ideas and reinforced them. Pharma sector in India. India's drug regulator, the Central Drug Standard Control Organization, CDSCO, has taken back the authority given to the state licensing authorities to issue no objection certificates for making unapproved, banned or new drugs for export. This comes because India is facing a lot of criticism for providing low quality drugs to other countries. Now, let us get into more of this topic and discuss actually what this whole idea is. In 2018, the Central Drug Standard Control Organization, what they did was, they permitted states and union territories, their drug licensing authorities to grant permissions to export some drugs, some specific drugs, wherein they would give permission to production facilities that were in their own regions, and they could export straight away. Now, the head of the, now this has changed. Now, the head of the zonal office will now grant the NOCs. Earlier, it was a state that was doing it. Now, the power has gone back to the center. Now, manufacturers must obtain NOCs through the Sugam portal before getting a manufacturing license from the state licensing authority. Now, Sugam portal is an online e-governance portal introduced by the Government of India to build an in-depth regulatory framework for registration processes of CDSCO. Now, let's take a look at the pharma sector in India. The Indian pharmaceutical industry is often referred to as the pharmacy of the world. We are one of the largest in the world, and we have had a major impact on medicines around the world. Now, India by volume ranks 3rd in the world in terms of production of pharmaceuticals, and by value it ranks the 14th, which is actually a very interesting statistic, which is to say we're actually underpricing most of the drugs and making it affordable for everybody around the world. In fact, there have been movies in the world. There was even a famous Chinese movie where one of the persons, it was about a Chinese person trying to get cancer drugs from India to save his loved ones. So this idea of India producing high quality medication, high quality pharmaceuticals to actually take care of the world is well entrenched in the global consciousness. Now, India is the largest producer of generic medicines globally, occupying 20% of global supply by volume. Now, generic medicines are extremely important because they allow us to bring down the prices of drugs. They're basically what actually allows people to, not go broke when they're trying to get themselves treated. Indian pharmaceutical industry offers 60,000 generic brands across 60 therapeutic categories. Now, India is also the leading vaccine manufacturer globally. 62% of the world's vaccine manufacturing vaccines come from India. And about 70% of the World Health Organization's vaccines are produced by India. Basically, the essential immunization that happens around the world, 70% of it is done by India. Now, what is the industry scenario in the pharmaceutical sector? Foreign direct investment is allowed. 100% foreign direct investment is allowed in the case of greenfield projects. And 100% FDI is allowed in the case of brownfield pharmaceuticals, wherein 74% is allowed under the automatic route. And thereafter, the government approves for the rest of the 26%. What is the market size of our pharma industry? In 2022-23, it was worth $50 billion. And exports account for 50% of the production. So we are exporting literally half our production to the rest of the world. And by 2024, that is by this year, we're expected to reach $65 billion. And by 2030, we are hoping that we'll reach $130 billion. Now, in terms of our exports, India supplies 50% of Africa's requirement for generics. 40% of the generic demand in US is met by India. And remember, United States is an exceedingly expensive place for getting any kind of medication. I mean, medical care basically kills people in the United States. And 25% of all the medicine in the United Kingdom is produced by India. Now, let's just take a moment and try and understand what's a greenfield project and what's a brownfield project. Now, in the case of a foreign direct investment, when a parent company opens a subsidiary in another country and invests 100% of it, instead of buying an existing facility, what they do is they build from ground up. They execute the entire project from 0 to 100. By basically they're constructing new facilities in that country, then we call it a greenfield project. Now, greenfield projects in India, 100% of FDI is allowed. There's no problem with that. Now, greenfield projects are basically where a foreign company decides to invest completely for the project and starts from the bottom, 0, and creates an entire company in the country. So then we call it a greenfield project. What's a brownfield project? Brownfield investments involve purchase or lease of existing production facilities for the purpose of beginning new production. And it's generally carried out by mergers, acquisition of existing companies in the destination country. Basically, India allows 74% of FDI in this case, and the rest of the 26% we allow after the government approves it. Now, in general terms, a greenfield investment can be called a foreign startup, while a brownfield investment can be called a foreign acquisition. Now, both greenfield and brownfield investments have their own advantages and drawbacks. While a company may prefer a greenfield investment since it gives maximum design and operational flexibility to meet its project needs, it also takes time and cost to develop production facilities. Brownfield investments prevent that kind of thing happening. But there is also an additional advantage of existing establishments. They would already have the requisite permissions, they'd have the paperwork done, they'd have the regulatory approval. So that's the advantage with brownfield investments. Now, the centralization of licensing authority, where does it take us now? Now that the NOCs can be granted only by the centralization authority, where does it take us? India needs to take advantage of the drug sales worth $251 billion that are going to go off patent this coming decade. So in the next coming 10 years, about $251 billion worth of drugs are not going to be covered by patents anymore, or that patents are going to expire. So India needs to take advantage of this. Now, expiry of patents is a very promising idea, and Indian generic drug market is expected to take advantage of this. And if we have uniformity in protocols, it will also help us achieve the target of $450 billion that we have for 2047. So the pharma sector, we are hoping by 2047 will be worth $450 billion. And getting NOCs from the local authority is both tedious and time consuming. and a centralized authority would be able to handle this much better. What are the challenges when we are trying to do this? There are intellectual property rights involved. There's a lack of research and development in the country. Now, lack of research and development is a recurring theme across sectors, and it actually has held back the country a lot. If you actually look at the percentage of investment that goes into research and development in the country across sectors, it's actually minuscule. So that is a huge challenge, and we have to address that. If we want to be the best in something, we must invent those things, not merely take from others and make minor changes and innovate. Innovate is good, but we also need to invent. Inventions cannot happen if we don't invest in research and development. Now, there's also a problem of understanding political, economic, socio-cultural and technological and environmental and legal factors. This is another huge challenge going into the future. And this is a vital thing for understanding the opportunities that will come up in the future. Now, if we look at the export of India's export share in 2020-23, about 72.54% are basically drug formulations and biologicals, and about bulk drugs and drug intermediaries are about 18.43%. Then the rest of it is basically vaccines, Ayush and herbal products and surgicals. Now, what is the India's country-wise share of drugs, pharmaceuticals and fine chemicals exports in 2020-23? 29.72% we have exported to the United States. 52.95% is the rest of the world. And our major export destinations have been Belgium, South Africa, United Kingdom, Brazil, Netherlands, France and Russia. So you can see this is how it is right now. It was in the recent past. Now, what is the size of the Indian pharmaceutical market? Like I just described, in 2021, it was $42 billion. In 24, it went to 65. And by 2030, we are hoping it will be 130. Now, how is the export trend of pharmaceuticals over the past few years? If you see in 2016 and 17, it was $16.8 billion. From there, we had a high in 22-23 of $25.4 billion. And this year, we are hoping to reach $25 billion. Now, what are the steps taken by the government to ensure quality of manufacturing? Now, there's been a crackdown by the government because if you remember, there were instances where children fell ill, children died because of the cough syrup that was exported from India. And this gave a massive beating to the image of the country as a pharmaceutical giant. And so the government has actually come down very severely on the people responsible. 18 drug companies have had their licenses cancelled. 18 drug companies have been pulled up for poor quality manufacturing and cancelled the license of over 10 pharmaceutical companies. And further 26 companies have been given notices for not complying with good manufacturing processes. Now, this is an idea we have discussed in the past, the idea of good manufacturing processes. The pharma industry has been repeatedly been brought to discussion tables to ensure that good manufacturing practices, standardized manufacturing practices are followed over a period of time. Now, there is a vision, Pharma 2047. The idea is to make India a global leader in manufacturing affordable, innovative and quality pharmaceuticals and manufacturing devices for the goal of Vasudhaivika Kutumbikam. So this is the goal we have. Now, if you see the idea, only part where we are really lacking would be the innovative part, because there we need to really invest in R&D. Now, we also have a national pharmaceutical policy in 2023. It serves as a comprehensive framework for addressing the challenges faced by the pharmaceutical industry, and it's based on 5 pillars. So these are the 5 pillars: fostering global pharmaceutical leadership, promoting self-reliance, and advancing health equity and accessibility, enhancing regulatory efficiency, and attracting investments. So these are the 5 pillars that have been laid out as part of the future, where the future of the pharma industry is going to be built upon. So this was about the pharma sector in India, and it's one of the areas where we should develop, we should end up being the world leaders. This sector, we should actually contribute for two reasons. One, it's a sector that actually has a lot of promise, and there's also a moral obligation. We are really good at this, and we need the medicines for ourselves. We have about 1.42 billion people, and we need affordable medication. And the poor people across the world, they also need affordable medication. So it's a win-win for the country. Comprehensive guidelines on the diet of vulnerable groups. India's premier nutrition research institute, National Institute of Nutrition, has published comprehensive guidelines on the diet of vulnerable groups, including pregnant and lactating women, children, and elderly. Please remember, this is vulnerable groups, and this is not vulnerable tribal groups. This has nothing to do with tribals or economically backward. It's not that. When we talk of diet, when we say vulnerable groups, we generally mean pregnant women, lactating mothers, children, and the elderly. So for those people, the National Institute of Nutrition has issued a set of guidelines. Now, this is, why did they do this? This is because the non-communicable diseases such as cardiovascular diseases, cancers, diabetes are rising among adolescents and even children. So it's necessary that we address this, and the National Institute of Nutrition thought that one of the ways to address this is through guidelines about what kind of diet we should have. Now, what are the status of non-communicable diseases in India? When we say non-communicable diseases, that basically means that one person gets it, another can't get it from him or her by merely, by being in contact with that person. It's not communicated from one person to another. Now, according to India Health of Nations States, it's a report by the Indian Council of Medical Research, the proportion of deaths due to non-communicable diseases has increased from 39.9% in 1990 to 63% in 2024. This is a huge leap. Now, cardiovascular diseases are the leading cause of NCDs, non-communicable diseases. About 27% of people who die of non-communicable diseases, they're dying due to cardiovascular problems. It's followed by chronic respiratory diseases, CRDs, that's 11%. Cancers are about 9%. Diabetes is about 3%, and other categories is about 13%. Now, there are four major NCDs. They share four behavioral risks. That is unhealthy diet, lack of physical activity, use of tobacco and alcohol. Now, what are the initiatives by the government of India to reduce prevalence of non-communicable diseases in the country? We have rebranded and expanded the National Program for Prevention and Control of Cancer, Diabetes, CVDs and Strokes. This was launched in 2010. It has been rebranded into the National Program for Prevention and Control of NCDs. Its scope has been increased. Rebranding just didn't mean that they've stuck a new table and said that okay, now this is a new name, it will work. It's not that. Besides that, what we have done as a nation is we have broadened to include a few other categories that will be covered by this. So chronic obstructive pulmonary disease has been added, asthma has been added, chronic liver disease has been added. Remember, chronic kidney disease has been added. Kidney diseases are fatal in the sense there is no cure for them. They can only be managed. Right now in the world, the only solution for a person suffering from kidney disease is either they can have a replacement of the kidney or they can only manage it. There's really no cure for kidney problems. And the last disease they've added is non-alcoholic fatty liver disease. So the scope of this has been increased, and there are new guidelines that have been issued. It underscores the financial burden of NCDs on individuals and the economy, and a situation that's driving a focus on primary and secondary preventions. We'll discuss what are primary and secondary preventions to improve the quality of care and services. Now remember, these are the kind of diseases that actually could financially bankrupt a person. So it's very important that we take care of them through preventive measures, through what we call primary and secondary prevention. Now, what is primary and secondary prevention? Non-communicable diseases can be prevented by reducing common risk factors such as tobacco use, harmful alcohol use, physical inactivity, and eating unhealthy diets. So this is a major thing. This is what the government is actually trying to emphasize on. This is what the NIN is also trying to emphasize on, that preventive, primary prevention. This is what it is. The secondary prevention, it reduces prevalence, but generally not the incidence of the disease. So what it does is, secondary interventions are effective only when they're implemented at an early stage. So screening for cervical and breast cancer, they're an example of secondary prevention. So we can't really prevent it, but what we can do is detect them early and save the life of the person. Now, what is being done? We are providing standard care. The Union Health Ministry is aiming to provide standard care to 75 million people with hypertension and diabetes by 2025. And this represents the largest coverage of the world in terms of non-communicable diseases in primary health care. Now, the National Institute of Nutrition, NIN, it was founded by Sir Robert McCarrison in the year 1918 as Beriberi Enquiry Unit and emerged as a fully fledged institute under ICMR, and it's located in Hyderabad. And 1967 it became a fully fledged institute of its own. It has attained global recognition for pioneering studies on various aspects of nutrition research, with special reference to protein energy malnutrition. Now, protein energy malnutrition is an idea that keeps recurring in the country, and we've actually had diseases like kwashiorkor and other diseases, which are basically due to absence of protein in our diets. And it's a lot more complicated than that, basically. So they have done pioneering work in the impact of protein on our health. Now, this is what we are trying to emphasize on, this whole idea, diseases of overnutrition. People are young and unhealthy. So obesity, about 3.7% of the population in the age group 5 to 9 years is obese. In the age group 10 to 19, 4.9% of the people are obese. Now, overweight and obesity is about 1.3% in the age group 5 to 9 and 1.1% between 10 to 19 years. Pre-diabetes, it's actually where you know that this person is borderline diabetic. So what happens is, their sugar levels keep going higher, just under the danger mark for diabetes. So those categories are categorized as pre-diabetes, and many of them can actually come back to, they can control their diets and they can come back to leading a perfectly normal life. So pre-diabetes, we have about 10.3% in the age group of 5 to 9. Imagine a 5-year-old child having actually pre-diabetes. And the problem with diabetes is inevitably leads to basically destroys all the organs in the body over a period of time if it's not controlled properly. And more importantly, can lead to kidney problems. And kidney disease, like I just described, is fatal. There's no cure. It can only be managed. Now, pre-diabetes in the age group 10 to 19 is 10.4%. So basically, and diabetes itself is 1.2%. 5 to 9-year-old children, 1.2% of them have diabetes. This is a scary statistic. In the age group 10 to 19, it is 0.6%. Hypertension, 4.9% of the children over the age of 10, under the age of 19 have hypertension. This should not be the case. It's probably largely caused due to our extremely stressful academic environment, our ultra-competitive education system and things like that. Those have to change, otherwise this is an extremely dangerous thing. Now, High total cholesterol, 3.2% of the children in the age group 5 to 9 have high cholesterol. 3.7% in the age group of 10 to 19 have high cholesterol. All this can be managed. All this can be managed through a healthy diet, through a healthy active lifestyle, through changes to the lifestyle. These can be brought down to zero. This is not impossible. Now, disease of undernutrition. See, India has a peculiar problem. We have both undernutrition and overnutrition, which is to say people are starving and people are also obese. So there are people who go without food in our country, and there are people who are eating so much that they're destroying their own health. This is a paradox that occurs over and over when we talk about India's development, because the development itself is skewed. And development has brought about a variety of problems over the past several decades, actually, not just today. One of the things is unhealthy diets. Eat a lot of highly processed foods, which have a lot of salt, so things like that. We'll discuss that. Now, there's also micronutrient deficiency. There is anemia in the age group 1 to 4 years. The government has also is working very hard on reducing anemia. 40.6% of the children in the age of 1 to 4 have anemia. In the age group 5 to 9, there are 23.5% children, which is to say almost 1 in every 2 children is anemic. It's almost 1 in every 4 child is anemic. And in the age group 10 to 19, there's 28.4% of people who are anemic. Now, this actually gets worse when we split it in terms of gender, in terms of boys and girls. And we have had a very detailed discussion about anemia in one of our previous lectures. Please do visit that. Now, there is also micronutrient deficiency, which are diseases of undernutrition. Anemia is largely because of undernutrition. There's just not enough iron in your blood. Your blood is not capable of carrying enough oxygen to the parts of the body. Iron deficiency, there is 32.1% in the age group 1 to 4. Sorry, 17% in the age group 5 to 9, and 21.5% in the age group 10 to 19. Similarly, we have vitamin A, vitamin D, vitamin A, vitamin B12, zinc. All these you can see here, they're all in varying degrees, about as high as 31.7%. This can be very easily managed. And this is what NID has suggested about how to manage these things. Now, the comprehensive guidelines on the diet for vulnerable groups says that 56.4% of India's total disease burden can be attributed to unhealthy diets, which is to say more than half of the people who are unhealthy. It's only because of bad diet, which can be actually handled. I mean, we have both the knowledge, we have the capabilities, and we have the production systems, we have the distribution networks. We can actually handle this problem very easily. Now, key focus areas of the guidelines for children, what they suggested is optimal nutrition for mother, child from conception till the age of 2 years is linked to proper growth and development. Basically, till the age of 2 is where most of the development is happening, and we have to be very careful that the correct kind of diet is given to the child, and we have to also feed the mother so that both the mother and child are healthy. Now, this can prevent all forms of undernutrition, including micronutrient deficiencies that we just described, and obesity, both sides of the coin. Now, the report says that the Comprehensive National Nutrition Survey of 2019, it shows that there's a high prevalence of lifestyle condition problems even amongst children. Now, like I just said, India is facing a dual nutrition challenge. Like I said, we have both micronutrient deficiencies and we have diseases of overnutrition, which is to say children don't get enough food and children are eating way too much. Not the same child. Now, a study on malnutrition said that undernutrition continues to be high in India, but obesity has increased enormously over the past 30 years. We've had a discussion on obesity in the country. Kindly visit that idea. Now, the incidence of micronutrient deficiency, zinc, iron, vitamin deficiency range, like I just said, from 13 to 30% between the ages 1 to 19. We just saw that. Now, there are several forms of malnutrition, such as marasmus. It's a deficiency of protein, carbohydrates and proteins. There's also kwashiorkor, which is a deficiency of protein. This has disappeared from the country. However, anemia continues to be a problem. Now, this is a very important factor. We don't eat a lot of meat in the country. People like to attribute it to culture and religion, but the actual fact is protein costs money. And we really don't spend that kind of money on protein, because of which we really don't eat. If you look at the facts, majority of the country doesn't have any religious restrictions about eating any kind of protein, that is to meat, eggs. There are only a few communities who, due to religious injunctions, don't actually eat meat, eggs, fish, chicken or something like that. And even that varies by geographical regions. In some of the geographical regions, especially say West Bengal or say Odisha or states like that, no community actually has any kind of restriction about intake of diet. But if you still have protein deficiency in that area, that clearly means that the reason they're not eating protein is because they can't afford it. So it's not so much a cultural issue as it is an economic issue. Now, the faulty dietary pattern in which unhealthy, highly processed diets, which have high fat content, sugar and salt, have become more affordable over a period of time. You see people eating a packet of chips just like that, or a packet of processed food just like that. And this contributes to both iron and folic acid deficiencies. So when you're eating a lot of highly processed food, it actually damages your health over a period of time. Now, what are the recommendations or the guidelines? What has the NIN said? Getting required nutrients from at least 8 food groups is essential. These 8 food groups are vegetables and leafy vegetables, roots, tubers, dairy, nuts and oils. It's very rare that actually people pay attention and ensure that all these things are, form a part of their diet. We just eat what is convenient. And many times we eat what's convenient that's not healthy. Now, consumption of cereals should be restricted. We are largely a cereal eating country. We either eat wheat or we eat rice. And more protein, that is pulses, meat, poultry, fish should be consumed. Like I said, there is a strong financial aspect or an economic aspect to it. We largely eat wheat, we eat maybe roti and sabzi, or we eat rice with maybe a bit of dal. We don't eat as much. The dal has actually quite a bit of protein, has about 28 grams for every 100 grams. It's about 28%, anywhere from 22 to 28%. But that's not our main diet. We eat it along with cereals. So now what NIN is saying is, increase the protein content in your food. Now, achieving adequate levels of essential polyunsaturated fatty acids and B12 is a challenge for vegetarians, because these are not part of a vegetarian diet. So now the NIN is saying find alternatives. So what the guidelines are saying is, eat flax seeds, chia seeds, walnuts, vegetables and greens, so that this can contribute to, this can make sure that that deficiency is taken care of. Now, salt consumption should be restricted to 5 grams a day. Both salt and sugar excessive intake can really damage the body. And the NIN strongly recommends against consuming highly processed foods that are typically high in fat, high in salts and high in sugar. It's like if you have a glass of Coke, most of it is just plain sugar. So avoid that. Now, there are age-specific recommendations. Pregnant women, what NIN has said is that consume a lot of fruits and vegetables, especially those in high iron and folate content. Now, if you remember, we have discussed, when we discussed about anemia, one of the things the government tries to do is give iron and folic acid tablets to pregnant women to ensure that this deficiency is taken care of. Now, in the case of infants and children, for the first 6 months, an infant should largely be given the mother's milk. After 6 months, complementary food should be included. For the elderly, they should consume food that is rich in proteins, calcium, micronutrients, and fiber. And exercise is important in order to maintain bone density and muscle mass. Now, loss of muscle mass is a very common problem among the elderly, and this is what the NIN is saying we should address. Now, this is the food diet. If you have 2000 calories a day, what we should be doing is we should have vegetables, about 400 grams of vegetables and 100 grams of fruits. Cereals and nutri-cereals should be about 250 grams. Milk and curd, that's people also started calling it yogurt, should be about 300 ml. Pulses and legumes should be 85 grams. 30 grams of pulses can be substituted with fish or flesh foods, that is meats. Nuts and seeds should be 35 grams. Fats and oil should be 27 grams. Now, the other thing is consumption of the following food. Let us say if you're talking about a woman's health and fetal development, we're talking about during a normal pregnancy for a woman. What the NIN has suggested is cereals and millets should be 240 grams a day. This can include a variety of foods. Pulses should be 80 grams. Nuts and oils and seeds should be 40 grams. Cooking oils and fats should not exceed 20 ml. Now, generally it exceeds 20 ml, the kind of oil that we take. Vegetables, roots and tubers should be 300 grams. Now, these are tubers would be like carrots, cauliflower, bottle gourd, snake gourd, pumpkin, spinach, things like that. Now, they also said that you should have green leafy vegetables, about 150 grams. And green leafy vegetables would be spinach, amaranth, fenugreek, mustard. These are all mostly seasonal. So basically the idea is that what is available in that season, you eat it in the right quantity. And fruits, about 150 grams of fruits every day. And marine fish or lean meat, about 80 grams a day or 250 to 300 grams a week. And dairy, about 400 ml every day. Now, in the case of an elderly person, let us say elderly person over the age of 60 years, their calorie requirements are about 1740 kilocalories a day, about 1740 calories. And crude protein should be 62 grams. Now, this is where actually most of the people actually have a tendency not to get that 62 grams of protein that's required in a day. And that is actually what leads to loss of muscle mass over a period of time. It also reduces bone density over a period of time. Actually, this is where we lack the most as a country. The focus on proteins. We really don't consume enough protein. Now, breakfast, they would say have about 420 calories. About lunch, you have about 760 calories. Dinner, you have about 490 calories. This is another thing we don't really do as a country. 7 to 8 p.m. is when NIN says we should have our dinners. Most of us tend to have dinner well after 8:30. 8 o'clock is kind of early for dinner for us. So this is a habit that the NIN is saying all of us should change. Now, evening, they say have a 70 calorie drink or 100 ml of tea or coffee, preferably without sugar. Sugar could be taken, but then you have to make sure that your sugar, you don't have a lot of sugar in a day and you keep it under control. Now, in the case of women, their calorie requirements are slightly less than men. So they have about 15 and 30 calories a day they require. And they need about 56 grams of protein. That's about 6 grams less than men. Now, we have to pay attention to one small thing here. In the case of both, when we talk of men and women, we are talking about a specific body type. If the person is very tall or big built, their calorie requirements would change. So you can't have somebody who's 6 feet having the diet that is suggested for a person who's 5.5 feet. So that changes. Now, again, the same set of ideas. You have 390 calories for breakfast. You have about 660 calories for lunch. You have about 425 calories for dinner. And again, a cup of tea in the evening. Now, like I said, these are the vulnerable categories. Over and over, please remember when we talk of vulnerable people, in terms of the health that is we were talking about their dietary requirements, we're talking about lactating and pregnant women, we're talking about the elderly, and we're talking about children. So these are the three categories. This has nothing to do with economically deprived categories. Those are generally the focus of discussion when we talk of vulnerable groups. When we talk of diets, nutrition, the vulnerable groups, or when we talk of health, the vulnerable groups are differently defined. Okay, now what NIN has said is they've given 17 guidelines. They've given a set of 17 guidelines which are to be followed, which are basically for the entire country, but more importantly for the vulnerable groups. Now, what they've said is ensure people eat a variety of diets. Ensure the provision of extra food and healthcare is provided to women during pregnancy and lactation. Ensure exclusive breastfeeding of the child in the first 6 months. Continue breastfeeding till the age of 2 years and beyond. Now, this is something we really don't do as a country. The cultural practice is to stop, breastfeeding a child around age of 1. Now, the new research and the new ideas that have come in, and based on a lot of supportive evidence, suggests that a child should be breastfed beyond the age of 2 years. So that is the new guideline. Now, start feeding home. Guideline number 4 is start feeding homemade, semi-solid complementary food to the infant soon after 6 months. Ensure adequate and appropriate diet for children and adolescents, both in health and sickness. Eat plenty of vegetables and legumes. Use oils, fats in moderation. Like I said, one of the problems of the developed world is, or rather one of the problems we inherited as you're becoming part of the developed world is a high reliance on highly processed foods, which are always high on salt, high in fat, and generally very bad for health. Now, obtain good quality proteins and essential amino acids through appropriate combination of food. Avoid food supplements to build muscle mass. Now, you must have seen, you get these protein drinks and protein powders and all. The latest research shows that those can actually lead to kidney damage. So they are saying that please don't use these protein supplements that say that you can build muscle mass. Because many times what happens even among the elderly, because of the way our diet is structured, we don't get enough protein. So people think that, okay, I'll have a glass of a protein drink to ensure that, I'm getting enough protein. But the problem is that can damage your kidneys. Adopt a healthy lifestyle to prevent abdominal obesity, overweight and overall obesity. Now, abdominal obesity is actually a critical point. When we try and understand the obesity issues that are there in the country, one of the key factors is abdominal weight, what we call the waist circumference. And the very simple way of understanding it is, if a person's waist is more than half their height, whether you can measure it in inches or centimeters, then the person has abdominal obesity. And this can actually lead to a variety of health problems. So NIN is saying that pay attention to that. Guideline number 10, be physically active, exercise regularly to maintain good health. Now, generally we say that get about 120 to 150 minutes of exercise in a week. Restrict salt intake. Consume safe and clean foods. Adopt appropriate pre-cooking and cooking methods. Don't overcook a food and don't undercook it. Especially this is common in the Western world, where they very lightly cook meat and have it, and that can lead to a variety of health problems. And it has been proven over and over, what they call rare cooked meat, rare cooked fish, that can actually lead to a lot of health problems. Could lead to, or sometimes even people eat raw fish, like in the case of Japanese sushi, that can actually lead to salmonella poisoning and things like that. So make sure that you're washing your food properly and cooking it adequately. Drink adequate quantity of water. Minimize the consumption of high fat and sugar, salt and ultra processed food. Over and over we're talking about the idea of ultra processed food. Include nutrient rich food in the diets of elderly for health and wellness. This is kind of the crux of the idea. Ensure that the food is healthy. And the last and the most important guideline is read the information of food labels on all the foods that you're purchasing. Make informed and healthy choices. So this was about the guidelines issued by the NIN about the vulnerable population, vulnerable people, and what they can do to ensure that they're not unhealthy. I mean, they don't fall prey to non-communicable diseases and things like that. So to sum up, we have a population, about 56% of the unhealthy people are largely unhealthy because of poor choices in diet and poor choices in lifestyle, and that can be prevented. Cancer screening at Ayushman centers. Now, in June 2023, the Niti Aayog had prepared a report to study the performance of Ayushman Bharat scheme. Now, we have discussed the Ayushman Bharat scheme in great detail. Please do visit those lectures. If you that will really help you understand how the scheme, what the scheme is, how it works, and everything. Now, this report has not been made public yet, but it is learned that the findings have been shared with the Ministry of Health and Family Welfare. About Ayushman Bharat scheme, we'll just quickly just summarize it. It was launched in 2018 as recommended by the National Health Policy that was prepared in 2017. Now, it adopts a continuum care approach comprising two interrelated components. So, we have the Pradhan Mantri Jan Arogya Yojana. That's a health insurance cover of 5 lakhs per year to over 10 crore poor people and vulnerable families for seeking secondary and tertiary care, and health and wellness centers. So, these are the two components. Now, this is how the comprehensive primary health care works. We have, it's how it's going to work through the health and wellness centers. We have expanded service delivery, we have expanding HR and multi-skilling, we have partnership for knowledge and implementation that's happening, community mobilization and health promotion is happening. Community mobilization is also an important part of the insurance schemes that we have discussed in the past. There's a robust IT system. We have ensured, or rather one of the key focuses has been to make sure that we have adequate data. And in the context of data, we have discussed this in the past as well, where many of the claims of the developed world about India and the data that we present, there's a lot of variation in that. And the reason for that is we actually have data, whereas they have a sample size. So when you see government data about, say, some health aspect of the country, be sure to understand that this is actually based on actual data that has been collected and collated from all parts of the country. And this is not based on a small sample size of 3,000, 10,000 and then extrapolated to the country. So robust IT system. Then there is financing and provider reforms. This is also, we've also discussed insurance in the past, health insurance in the past, and how the government is working very hard on that. And then we talk of medicines and expanding diagnostics. Today we are actually focusing on this. And continuum of care, telehealth and referral. So these two things we'll be focusing on today. Now, the Ayushman Bharat Health and Wellness Centers, let us talk about them. In February 2018, the Government of India announced the creation of 1,50,000 health and wellness centers by transforming existing sub-centers and primary health centers. Now, the country we have, when you go to small villages or even villages in the city, urban villages, like Delhi has about 120 villages inside the city, there you really don't have the space or the capacity to run a hospital. So what we have there is a primary healthcare center, what we call a PHC in the case of, in the case of villages or small places, we call them PHCs. Those have been transformed into health and wellness centers. In 2018, the government basically upgraded them and said that from now on we're going to call them health and wellness centers. Now the goal of the government is to ensure quality healthcare closer to the community. Now these PHCs are generally located very close to where people live. So you don't have to travel a large distance or anything for accessing them. What the health and wellness centers that have been upgraded now, they basically are easily accessible to people. Now this ensures that there are healthy outcomes and reduces out-of-pocket health expenditure for individuals and families. Now remember, we have also discussed this idea again when we are talking about health and health insurance and things like that, about what we call out-of-pocket expenditure, which is to say, let us say somebody falls ill. A part of the illness might be met by their existing healthcare plan in terms of maybe an insurance scheme, or if they're from the government, maybe the government pays 90%, or the job provides a certain health scheme. Besides that, a part of the illness expenditure is met by the person who has fallen ill. That is called out-of-pocket expenditure, and that is generally a very good measure of how expensive an illness is going to be for a person and for a family, what kind of financial burden it's placing on the family. The focus of the government over the past few years has been to reduce the out-of-pocket expenditure by adopting a variety of measures. Now, of course, there are also other, what we basically do is we try and make sure some of the scheme, some of the parts of our health expenditure that have been left out are brought into schemes. For example, maybe people pay for an ambulance, or people pay for a set of diagnostic tests. So what we do is we expand those definitions, ensure that they come in, thereby reducing out-of-pocket expenditure. So this is one thing the government has been doing. Now, other thing is this: the health and wellness centers, they provide free essential medicines. They basically are your first call of illnesses. That's where you first go to them. So they have the essential medicines, and they also have diagnostic services. When they were upgraded, they have been provided diagnostic services. There is teleconsultations that can happen now, and health promotion, including wellness activities like yoga, have been added to the health and wellness centers. Now, health and wellness centers offer annual screening for those who are 30 years or older for non-communicable diseases. So if you're 30 or you're more than 30 years old, every year you should go and get yourself tested for non-communicable diseases. So you should have yourself tested for hypertension, diabetes, and 3 of the most common cancers in India, that is oral, breast and cervical. So these are provided free of cost. Now, there is a cancer problem in India. In 2022, India had 14.1 lakh new cases of cancer, and over 9.1 lakh people died. That's almost 1 million people died due to cancer. Now, breast cancer was the most common form of cancer according to the latest estimate of the disease by the World Health Organization. So in terms of global burden, breast cancer has emerged as the most commonly prevalent cancer. What are the most common cancers among men? Lip and oral cavity cancer and lung cancer. They account for 15.6% and 8.5% new percent of the new cases that are being detected. Most common cancers among women, like I just said, breast and cervix cancer. Breast cancer cases are about 27%, and 18% of the new cases are cancers of the cervix. Now, what are the key findings of the report? 6 years since the launch of Ayushman Bharat, 5.47 crore individuals have availed of the insurance scheme. And however, when it comes to cancer screenings, there's a huge gap. Not enough people are being screened for cancers. Now, what are the takeaways from this? Currently, there are 3 distinct methods for screening for cancers. There are oral visual examination for oral cancers. There is visual inspection with acetic acid for cervical cancer. Under this, the cervix is examined after the application of 3 to 5% of acetic acid. This is the second method. And the third is there is a clinical breast examination for breast cancer for the people in the age group of 30 to 65 years. Now the problem is most people are not being screened for this. Most people are not aware that these are cancers that are highly prevalent and that it's actually very important that these are detected early so that they can be treated. Now, nurses and midwives in health and wellness centers were meant to be trained in these 3 screening methods. However, there's a gap in the training, so they're not yet been fully trained to screen for these cancers. The training hasn't reached the levels that have been expected. For example, provision for screening of cervical cancer is yet to be operationalized. The report also flagged that NCD screening was underway at most of the facilities. However, yearly screening was largely absent. So somebody is getting themselves screened for non-communicable diseases once in a way, but not following it up on a yearly basis. Niti Aayog also found that health and wellness staff had limited or no knowledge of the fact that hypertension and diabetes had to be screened on an annual basis. Now, this is again a huge fact that has come out. This is a huge lacune that can be corrected quite easily. Actually, it's not impossible to do so. What are the positive takeaways? The report said that the infrastructure in health and wellness centers was in accordance with the standards as envisaged by the operational guidelines. So whatever we had thought we'll achieve in terms of the standards that were set in place, we have achieved that. All basic devices such as a stethoscope, BP apparatus, that's a digital BP apparatus and not the mercury one, a weighing scale, which is actually used for adults and infants. In fact, the health and wellness centers are also very important for running a variety of vaccination programs and other things like that. Now, clinical thermometer, that was also available. These are all available and functional in the health and wellness centers. Now, Niti Aayog also found that medicines and diagnostic tests were available free of cost in all the facilities that were visited. So this was about, this is how the health and wellness centers are right now. And now the focus is, like I said, on actually screening for cancer to ensure early detection so that deaths can be prevented. Now, status of spice exports. Now, as all of us know, India is basically the world's largest exporter of spices. And the reason that we produce spices was why we were colonized. I mean, people came here basically to buy spices and then they colonized us. Recently, there's been an issue with our spices that are being exported. So let us discuss that. Now, Hong Kong and Singapore recently recalled certain spice mix products from MDH and Everest Group due to higher than prescribed levels of a sterilizing agent called ethylene oxide. In response, the Indian authorities have initiated a lot of measures to ensure that the Indian spices comply to food safety standards of the importing countries. Now, we don't want our image as a spice producer, as a spice exporter to take a beating. So the government has acted very promptly, and we have already set a new set of guidelines in place. Now, let us discuss a few more things about this. What is the size of the Indian exports in terms of the spice market? In 2023 and 24, India exported spices worth $4.4 billion. That's nearly 14 lakh tons of spices were exported from the country, which is 12.3% higher than the previous financial year. Now, what are the products that are exported? I mean, we literally have like more than 300 spices in the country. So what are the major components of the spices? What are the biggest export from the country in terms of spices is actually chilies. Now, what are the major products that are exported? Chilies, spice oil, oleoresins, curry powder paste, cumin, mint products, cardamom and pepper. These are some of the major products. And these are the largest products that were exported in the year 2022-23. In terms of production, garlic, ginger and chili were in the top 3 spices produced in the financial year 2022-23. What are the major export destinations for us as a country in terms of spices? India exported spices basically around the world, but most of our spices have gone to 180 countries in the world. Most of our spices, however, have gone to China, Bangladesh, West Asian countries, and the United States. These are our major export destinations. About the recent incidents of contamination, in May 2024, some spice mixes from the Indian brands Everest and MDH were found to contain ETO. This is not just a sterilizing agent. One of the problems with ETO is in higher concentration, it can actually lead to cancers. And because it's a cancer-causing chemical, it is banned in several parts of the world. It's banned in Singapore and Hong Kong. And when this was found in the food, that were in the spices that were exported from India, immediately there was a recall of these products. Now, the source of contamination, how did this contamination happen if it's such a dangerous thing? India does not use ETO as a pesticide, but as a sterilizing agent. Basically, what happens is when you have spices brought into a factory, there's a lot of microbial load in that, and you want to reduce the microbial load. So ETO is used to ensure that the microbial load in the spices is reduced. So when you have the finished spice, you reduce, in order to ensure that the microbial content is not high and it actually doesn't destroy the food and doesn't destroy somebody's health, ETO is used. Now, how does actually microbes get into food? Spices and other agricultural products are often contaminated in the mandis. We know where their food is kept, food is dried, food is sold. Due to they come in contact with humans, birds, reptiles, and insects. This leads to contamination. So, in order to reduce this contamination, sterilizing agents are used. Large factories, when they get material from these mandis, they are left with spices that actually have a very high microbial content, because of which they are forced to use ETO as a sterilizing agent. That is the reason we have ETO in these spices. However, food contamination can be reduced early through value addition processes. There are processes that are done which can reduce the contamination of the food. Consumers are generally encouraged to focus on the quality of the product and not on the prices, basically because that will ensure that you have a safer and healthier product. What happens is the process that is used for actually decontaminating this adds to the cost. So if you're getting a cheaper product, you're probably getting a product that's not healthy. We mostly concentrate just on the flavor or the fragrance or the texture or something like that. And we really don't know what kind of process is used for actually making a certain spice product, about what kind of sterilizing agents are used and how they actually reduce the microbial load. We are not aware of that. One way of knowing that is, if the price is slightly higher, it's probably because they're using a process that's costing them more. Now, the impact of the recall, it's a recall and not a ban. MDH and Everest spices have not been banned. All the spices from India have not been banned. It's only a recall. An official from the Federation of Indian Spice Stakeholders clarified that Singapore and Hong Kong have recalled these products but did not ban Indian spice products. This is a very important distinction. Now, exports to these countries have resumed. So, significant impact in terms of exports of spices is not expected in the coming months. Now, in terms of global spice production, India produces about 70% of the global spices are produced in India. So, we literally are the spice basket of the world, along with being, a pharma superpower and things like that. We actually have been producing 70% of the world's spices. Now, what this effectively means is any damage to the image of the country as a spice producer can have disastrous effect, and it lasts several times. So that's where the officials have acted immediately. Now, what have we done? Now, there are varied standards. There are no standardized, there's no uniform standard across the world. Several countries have several different standards, and they have several standards for ETO and maximum residue levels. So ETO and MRL, every country has its own standards, and we have to meet the standards of that particular country. While ETO is permitted by the United States, EU seeks steaming as a method for sterilization. So EU does not allow anything with ETO in it. So European Union asked for a process called steaming, which actually costs a little more. They say that you can't use ETO, but you can use you can sterilize using steaming. Now, the cost of ETO as a sterilizing agent is 5 per kg. And the cost of steaming is 20 to 25 per kg. Now, this is what I was telling you. When we buy a product that's slightly higher, it's probably because they have steamed the product to reduce the microbial load instead of using ETO. Now, the Indian spice industry is urging the government of India to say, talk to the EU and have a trade deal or something like that, where they'll allow ETO, so that we can send our Indian spice to European markets. This is probably in the future. Also, they're saying that the Indian government should lay down achievable guidelines and tell the buying countries about it, saying that this is what is actually possible considering the process through which these spices are produced, and this is what we should convey to the countries that buy from us. Now, what are the India's spice export trends? If you see the spice export trends, this is in millions of US dollars. In 2016 and 17, it was about $2.6 billion. In 21-22, it went to a peak of $4.17 billion, 4.17, dipped a little, and between 22-23, it was again about 3.7. In 23-24, so far it has been 3.65. Now, if we look at what spices we export, seed spices are about 46%. So chilies will be here. Now, tree spices are about 3%. Others are pepper is about 4%. Pepper being the reason we got colonized. Ginger is about 4%. Chilies are about 26%. Turmeric is about 6%. Garlic is 8%. And cardamom is about 3%. Now, who are the top exporters in the world when we talk about spices? India exports about 3.89 billion. I mean, we just saw the figures very repeated up. Interestingly enough, the second country in terms of exports is Vietnam. They export about $2.94 billion, which is actually quite impressive considering the size of the country. Then you have Mexico, which exports about $1 billion. Then we have Peru, which exports about $500 million. Then we have Uzbekistan, about $484.86 billion. Pakistan, about $413 million. Chile, about $322 million. Turkey, about $294. Now they want to be called Turkey. Please remember that. Colombia exports about $209 million. And Ethiopia exports about $68 million. Now, what is interesting is, Ethiopia, their food palette is very close to India. And in fact, their cuisine is very similar to ours. And probably if you ever get to try it, it will be probably very similar to what you eat at home. Now, what are the steps taken by the government? Now that we have an issue, the government has acted very promptly. And these are the issues, these are the steps taken by the government. We have issued protocols. Following the recalls by Hong Kong and Singapore, the Spices Board of India issued a detailed protocol to all manufacturing exporters to prevent ETO contamination. Because we don't want a case where several countries are recalling our products. So immediately we have said that if your country that you're exporting to has a ban on ETO, do not use it. It's a very simple idea. Now, the other thing we have initiated is mandatory testing. The Spices Board of India has initiated mandatory testing of spice consignments destined for Singapore and Hong Kong. Especially for ETO levels. Now, international standards. A Spices Board has engaged with International Food Standards Body to address the need for uniform ETO usage limits. as these standards vary across different countries. Now, the other thing they've said is consumer awareness. The consumers are being encouraged to pay more attention to the quality rather than just the prices. This will ensure that every company is forced to actually produce products of a higher quality. And the spice industry and the government are working together to ensure that the Indian spices comply with the varying standards of different countries and to prevent any future incident like this. Now, let us understand a little more about ETO. ETO is a colorless, flammable, and in many ways a remarkable gas that was originally intended for sterilizing medical devices. So a gas that was originally used for surgical purposes for medical devices is now also been adapted to be used for reducing the microbial overload in spices. Now it is used as a chemical in industrial settings. It's used in agriculture because agricultural products have the same problem of contamination. I mean, you have the same issues. And it's also used as a sterilizing agent in food products, including spices, dried vegetables, and other commodities. And the chemical lends life to the spice industry. It reduces microbial contamination, because of which it extends the product shelf life and makes the storage safe. So basically, you can keep a spice for longer because ETO has been used. But the idea is that ETO has to be under a certain limit, otherwise it can lead to cancer. The improper and excessive use of ETO can leave behind residues that can lead toxic and even carcinogenic compounds to be formed, and that contaminates the product, and that actually is extraordinarily dangerous. Now, one such compound that is formed is what is called ethylene glycol. It's an ingredient that was found in Indian Indian-made cough syrups, which were linked to the deaths of children, about 300 children in Cameroon, Gambia, Indonesia, and Uzbekistan. Now, the Food Safety and Standards Authority of India, they've had a response. They've said that we'll increase the default limit for pesticide residues in spices to 0.1 milligrams per kg. It's actually a tenfold increase over the previous 0.01 milligrams per kg, because the idea is that having impossible limits, nobody is going to meet it, and then every product fails. Now, this will be only applicable in cases where Indian regulation does not specifically mention the maximum residue limits for a pesticide in a crop. If that has been mentioned, they'll have to meet that. Otherwise, this will be the new standard. However, the default maximum residue limit for other food products remains the same at 0.01 milligrams per kilo. Now, what are the reasons for increasing limits for spices, the MRL for spices? It's difficult to keep the limits at 0.01 for spices because of the compounding effect of phenols present in spices. Now, spices basically have their flavor and fragrance and everything because of the phenols that are basically oils that are present in that. Now, those phenols actually complicate it. They interact with the ETO and they can actually increase the levels because of their compounding factor. The Food Safety Authority of India is saying that we'll increase the levels to a more reasonable limit. The other reason is imports from countries may contain pesticides that are approved for uses in countries but not in India. So we have to account for that. There could be seepage of pesticide not approved in spices from other crops where it might be allowed. Now, prices many times are grown with other crops. If pesticide is allowed in that crop, that could seep into this, and that could also lead to a rise in MRL. So that is the other reason. Now, what are the concerns raised? Activists have said that allowing for higher limits will have a devastating effect on our health. So that is what basically they have said. Now, let us take a little closer look at the exports from India in terms of values. We just discussed this, but just basically chili continues to be the most important export in terms of spices, followed by cumin, spices and oils, and mint products, and other spices. So this is how the chart is. Now, what are the major contributors in the Indian export basket? Like I said, chili is the major one, and as you can see, others. This is how basically it is. You can take a look at that. Now, this is more important. What are the major destinations where our spices go to? As you can see, China is a major destination for our spices, followed by the United States, Bangladesh, like I told you earlier. The Middle East, UAE, for example, 6% of our exports are going there. Thailand, Malaysia, Indonesia, Sri Lanka. Sri Lanka itself produces a lot of spices, but still is an important export market for us. United Kingdom, Saudi Arabia, Germany, Netherlands, Japan, Nepal. Nepal, despite its size, it still is getting about 2% of our spice exports. Australia, Singapore. So this is how it is. Interestingly, Vietnam, we are exporting about 1% of our products to Vietnam, even though they are such a major exporter of spices. Now, if you see in terms of value, in terms of how much are we exporting to each country, in crores, about 6,391 crores is exported to China, followed by the United States about at 467 crores, Bangladesh at about 2,000 crores. You can see the figures. Okay. So others are about 5,236 crores. Now, there is another issue that has happened very recently, which is actually not in your text, but this will probably be covered at a later stage, or at least let us just cover it quickly. Now, Rajasthan authorities have found that MDH and Everest spices, they're unsafe. Now, Rajasthan state authorities earlier in a statement said that they have seized about 12,000 kilograms of various spices for alleged contamination. Some of these spices, as per the statement, they said they have very high levels of pesticides and insecticides. Now, Rajasthan's Food Safety Department declared that they found certain spices of the popular brand MDH and Everest unsafe for consumption. And this Rajasthan state authorities have written to Gujarat and Haryana, where MDH and Everest are produced, where the batches were made, to take action in the matter without any delay. So that was about the spice export from India and the issues that have come up. And this was covered quite a bit in the media, in the papers and everything. And it's a very important topic because spices are kind of central to our identity as a culture, as a nation. And spices have formed a major part in our history. And our own development as a country has been affected very interestingly by the presence of spices in our country. So I hope you enjoyed the lectures today, and we'll meet again, and best of luck for your preparation. Thank you very much.